to this parent and caregiver interactive session that has been put together by the Center for Autism and Neurodevelopmental Disorders of the College of Medicine, known as CAND. I am Dr. Yewande Oshodi, consultant child and adolescent psychiatrist, and I'm also one of the faculty at the Center of Autism and Neurodevelopmental Disorders. You'll meet a few other members as we go along. I want to thank you all for taking our time to come in on time. We have quite a few people that have registered, and I'm sure they'll join us shortly. But in the interest of time, we're going to set the ball rolling right away. I just want to give a little background just in a minute about the Center for Autism and Neurodevelopmental Disorders. It's a mouthful, and so we like to just call it CAN-DO. That means we can do this. We have a can-do approach, and we know that autism and other neurodevelopmental disorders can be challenging, particularly for the individuals that live with them and the parents that care for them. And we have this research institute set up in the College of Medicine to support parents by way of hand-holding through the journey, guiding to services in the community, assisting with diagnosis, and providing direction for options of care in our environment. We do know that we're one of those settings in which we have our services a little bit more scattered around the place. So at times parents do struggle not knowing where to go to. So at CAN-DO, we like to see how we can offer some direction around all of that. So we have this interactive session that we set up every quarter. So this is one of them. So you're all welcome once again. Today, we have the privilege of having a parents couple on the call, and they are going to share with us their experience along this journey of being parents of children with autism spectrum disorder. I will introduce them in a minute. So that will be our first segment. And then the second segment, we will have an interactive session with a very, very experienced professor of pediatrics and pediatric neurologist named Professor Leshi. And he's going to be available to answer questions so that you have some practical and science-based answers to whatever questions you may have on your minds around caring for the care you've received. And we may not have all the answers, you know, given on this one call, but we'll definitely have answers that can help you one way or the other. So to jump right in, I'd want to just introduce our pair parents who are going to take on the next 30 minutes or so, telling us a bit about their journey caring with children with autism spectrum disorder. So our guests are Mr. Banji and Shola Fatoba. They're parents of two lovely neurodiverse children aged 9 and 6. They have been on this journey for almost a decade, and they are founders of Bloombody. Bloombody is an ecosystem that they have set up that connects individuals, professionals, parents, and caregivers with licensed specialists. So they have this great app they've put together, and we're hoping that some people will definitely begin to use it. And they connect parents and caregivers with licensed specialists and board certified interventionists for mental and behavioral and neurodevelopmental wellness and support. So that gives you a little background about who they are, but more importantly, because they're going to speak to us today from their own journey, real lived experiences as parents of children that are on the autism spectrum. So without much ado, I'd want to hand over to Mr. and Mrs. Fatoba. Are you in the room? I can see you. I'd like to see your videos. Please put on your video.
Good morning.
Okay. Hi, guys.
Hello.
Hello.
You're welcome. Okay, so it's evening here in Nigeria. You know, I know you're not in the country, and you've just let that out of the bag by saying good morning to us all. Okay.
Good morning. Yeah.
Yes.
Thank you for having me. So we're really excited to be able to share. Thank you for this opportunity.
Mr. Fatoba, can you come in the frame, or are you going to, so that.
Let me shift this.
Thank you.
Okay.
Thank you.
Okay.
Perfect. Thank you.
Okay, great. Okay, can everyone see our screen?
We can.
Yes, we can.
Okay, great. So, hello, everyone. Like Dr. Oshadi said, we are two parents of two neurodiverse children. My name is Sholaz. This is my husband, Banji. And we have been on this journey about 10 years with our children. And honestly, the reason we wanted to even be able to share this when we're asked to share was we know that this is a journey that almost everyone in this room is going through. And as proud parents of not one, but two amazing neurodiverse children, we totally understand the roller coaster that comes with, doing this journey. And sometimes it feels like we're starring in our own reality show. And so what we are hoping is that we can share some of the wisdom and tips that have helped us along the way, especially with helping with our children cope, supporting our little heroes, and also dealing with, sometimes hurtful comments and misconceptions that we may encounter when we are interacting with people regarding our children. So today we would like to share those tips on some of these also familiar situations, and we're hoping that it can be helpful for you. One of the things I wanted to start out with was this is a poem called Welcome to Holland. And I'm hoping that every parent can get it in this room, can get a chance to just Google it. But it was written by a writer, Emily Pearl Kingsley, who is one of the writers for a favorite children's TV show, The Sesame Street. And she has a child on the spectrum. And I'm just going to give a very brief summary of this poem and why I think it's important for every parent to read it. But she talks about going on this trip, and she's going to this amazing trip that she's planned for, and she's likening it to having a baby. And she's picked Italy to go to. She's learning the phrases and handy things to learn about Italy, visiting Venice and all the amazing places. But then when the plane lands, she ends up in Holland. And she's like, Holland, I signed up for Italy. Why am I in Holland? So of course she has to readjust and realize that, hey, Holland is still a great place. It's not like it's a terrible place, but she has to, learn, get new books, get new guides, and learn this whole new language and a new culture. And it's kind of the same journey with us as parents. It's, you prepare for that baby and, all your expectations change because it's not what you expect, but it's still an amazing place to be. So if you get a chance, just Google Welcome to Holland. I'll email it after this segment, and hopefully it can inspire you when you read through it. But I'm going to hand over to my husband, Banji, right now.
Thank you once again I hope you can hear me though. But thank you once again for Dr. Shudi and CAND team for allowing us to share our story and our experiences. From the picture, this next slide, you can see our two lovely, energetic children. My daughter, his name is Tammy Laura. She's 9 years old. She's on the spectrum. And our son, 6 years old, his name is Tomide. He is diagnosed with ADHD. We're excited opportunity to share our story with you. Can you hear me? Hello?
We can hear.
Yes, we can hear you.
Okay.
I can hear you, although one or two people said they can't. So please, if you cannot hear, I suggest maybe you log out and log back in. It may be your network. Yes, well, I can hear you. Okay.
So I've just introduced everybody to our two amazing children. Move to the next slide now. Now the challenges of an exceptional learner are challenging for the parents as well. We consider our children and children on the spectrum to be exceptional learners. They're not the regular children, So everyone in this room has experienced sometimes a journey of maneuvering through supporting your child's needs. Sometimes it feels like we're starting in our own reality show. Survival is the game. It is very, very challenging, but it's very, very possible. I just hope that as we share our stories, it helps you navigate your own journey as well as a parent or as a provider of these services. Let's move on. So there are some tools that have helped us. The first one here is find your tribe. Find your tribe. Now, it's important that you connect with other parents who understand what you're going through, who understand your journey. I know that I believe that most people on this platform are Nigerians, understand our culture, but even within our culture, within the country, you can find people who have similar challenges that you have with your children that you can connect with. So find your tribe. Now, some of these parents they do not need to be parents with neurodiverse children. They just need to have the love and empathy for your family to work with you. You can build a trust circle, within that tribe by finding these people. The next slide.
So I was just going to add to that, building your tribe is very important because even for us, I know going out to, there were times we would go out with our daughter and she was very sensitive to noise and crowds, and we would have screaming matches. And there were situations where we would have to leave the establishment where we were. And the more we started to build our tribe and found people who weren't exactly, put off by, our child, they understood our challenges. They helped us in public, and it gave us the confidence to be able to, okay, she's screaming, she's having a tough day. And we were able to just feel more, like we belonged. And so rather than change our family lifestyle to just sitting at home, because at some point we felt like we couldn't even go out because of our daughter, we started to find those people who really became our tribes and who could really support us emotionally in the things that we did.
The next one is the knowledge knapsack. Do you want to take this?
Okay, so the knowledge knapsack. So I think of it as carrying a bag of all the tools that you need. So I think it's very important for us as neurodiverse parents to educate ourselves and arm ourselves with the facts about what neurodiversity is, whether it's ADHD, autism, whatever your child's challenge is, because you are going to be the biggest teacher of the people in your network. So you need to learn about your child's condition, stay updated on the latest research. And I'm not saying become a bookie, but know enough that you can be able to throw facts around and help people understand. So when people, throw out misinformation about it or stereotypes, you're able to correct and you're able to teach. Most of our friends in our circle have learned a whole lot more about autism and ADHD because we talk about it like part of our regular conversation. We say, oh, why does she do this? Oh, yeah, she has challenges with crowds. She has issues with textures, so she's not going to be able to eat that. So they don't look at her as strange, but they understand this is what she's going through, and we're able to help shut down any sort of ignorant comments that people might make intentionally or unintentionally. So keep that knowledge knapsack full.
I just want to say, sorry, that this point, not having the knowledge knapsack connects to the first point about the tribe. Now, with this information that you have, you can, with the right tribe, you get a chance to educate people about this knowledge, and even with the right information that you need to get, that you need to get, it would help a lot in the circle that you're building together. Now, the third point is to advocate for your child. I mean, this is, that if a parent whether your child is neurodiverse or not, you advocate for your children. We all do that. It's a given. But for children in this category, it's important that you create a support squad around your child. This is very critical. This comes whether it's the nanny or the teachers at school or the therapist, family members, or even siblings. Teach them, advocate for them, let them understand what you're going through. Let them understand, let them be your voice, let them be your ears, let them be your arms. Because as a parent, you will not be everywhere. You cannot be everywhere. And when your kids are in school, you have no idea what's going on. But that teacher or teachers in that school can be your ears, can be your eyes, can be your arms, Babe, you want to add to that?
Yes, I wanted to add to that. So I'm going to give a very quick example. Our daughter was in a private school she was going to in Lagos there, and there was a situation that was happening for almost 2 or 3 semesters that we weren't aware of. We were paying for extracurricular activities for piano, sports, and I forget the other, ballet, dancing. And we didn't realize that the teachers were finding her disruptive and they were not communicating to us that they were uncomfortable with her. And they started leaving her out of the activities. We didn't know this and we were paying and the school never told us. So we eventually had a speech therapist that we started having going to her classes to support her in her learning. And he called me up one day and said, hey, I've been going to school like a couple of days now, and I walk into class and your daughter is alone in the classroom, but all the other kids are in activities. What's happening? I called the school and found out that, they pretended like they didn't know that they forgot that we had been paying for the activities. But I said, why would you forget one child is paying for the activities? And you never called us. How long was this happening for? Again, it was very helpful to have these advocates for our child in the school. And, we trained the therapists, the teachers, everybody that interacts with our kids, so that they also speak up for the child. Our daughter is partly verbal. At this point, she was actually nonverbal. She didn't have any speech. So there was nobody to speak up for her. So it's very important that you build those strong advocates around your kids. If your child is being mistreated, you want to make sure that they are protected. So.
The boundaries barrier. Babe, you want to take this?
Yes. So setting boundaries. This is a huge one for us. You need to be clear about your expectations with your friends, your family, your network. Set boundaries like a pro and don't be apologetic about it, because a lot of times the stress you feel, nobody can understand it. All parents go through stress, but there's a different stress you go through as a parent of a neurodiverse child. So be honest about setting those limits. And I'm going to give you an example. Recently, my son was diagnosed with ADHD, and the specialist who diagnosed my son recommended us putting him on some medication because he's super hyper. And we found that when he's able to settle down, he's able to learn, but he couldn't do this on his own. My husband and I thought through this. It was a really tough decision for us, but we said, hey, his learning is important for him to survive. And so we decided to go with it, but we shared this with our family, and it was met with very, very strong, what's the word I would say? Resistance.
Yeah.
And people were very, very, they love my kids. I trust my family's heart for my kids, but everybody had an opinion about, what was the best way for my son. But again, we are his parents. We also know a lot of what he's dealing with. We know a lot of the challenges he had. We're spiritual people. We prayed about it. We did our research. The specialist, I must have called him a million times. I'm so grateful for his patience. He's actually in this group today. And he just really walked us through what are the side effects, what to expect, and he's walked with us through it. And but again, setting those boundaries and saying who can make decisions for your child. Yes, advice is good. Even unsolicited advice can be good, but ultimately you are responsible for your child and you're also responsible for your stress levels. So be aware of that. And also feel free to also turn down activities that trigger your child. So there are family events that we've had to turn down, school events, things that just don't work for our family, and we don't feel the pressure. There are times we've not gone to church because, hey, it's a Thanksgiving service. It is just too much activity for our kids. So manage your boundaries.
The next point is put on your confidence. Now people are going to say, well, we live in Nigeria, and our country can be very, very religious. We know that. And I believe people mean well, but then they see certain words and phrases to you, excuse me, that can be very, very hurtful. But that's why you need to put on, as a parent or as a caregiver, you need to put on your confidence cape. I'm sure you've heard some of these words. Are you disciplining your child enough? To consider that your child is not disciplined, and that's why your child is all over the place. Or some people said, your child just needs some good spanking or timeout. She needs some good flogging, good spanking. Or you've heard, I think your child is tongue-tied. Have you had him checked? Tongue-tied. Now, we have heard all of this, and I'm sure you've heard so much more. And that can be very, very, it can make you feel a certain way. You know, it's you make you, as a parent, in certain words, they make you wonder your parenting, make you doubt your parenting. But I tell you that you need to put on your confidence cape. And that's why, again, going back to the initial point, to educate yourself, get the right information from the right sources, though. It's very important to get about your child so that, you know, whatever is said, you can maybe give you an opportunity for you to educate those people about some of the comments that, yes, they may mean well, but it can be very, very destructive sometimes. You know, and I can see this as a parent, how it can really, really hurt sometimes. So please put on your confidence cape. The next point, be your child's biggest fan. Be your child's biggest fan.
So I love this point because, you know, one of the first things the neurologist told my daughter, that the neurologist that diagnosed my daughter was, he says, you are her lioness. And I will never forget that statement. He's like, you're her protector. He's like, she's going to see who she is in your eyes. And he says, you have to be strong and you have to let her know that she's amazing just the way she is. And it was one of the best advice he ever gave me. And so my husband and I look at ourselves as our kids' personal cheerleaders. And honestly, my kids, they look at us like everything they do, they look to see a mommy and daddy happy. Mommy and daddy, you know, happy with what I'm doing. We celebrate every milestone. My daughter, for example, she's going used to us recording every major thing she does. If she says a new word, it's like, grab the camera and we're recording it. And then she starts to act for the camera. And we find that her words are coming out more because she wants to perform for the camera. And once she's done, she runs, you know, and she grabs the phone from you and she wants to replay and watch herself doing it. But it's just a reminder for us that she loves that we celebrate her, that it could be that she just ate rice and that's, you know, she's very picky with food and she ate something new and we're like, we celebrate like, yay, Tamara loves, you know, ate rice today, you know, and her brother is following in the same footsteps. And so celebrate your kids and let your eyes be the mirror in which they view themselves, that even if they don't find confidence anywhere else, they know that with mommy and daddy, man, you know, I'm perfect.
The empathy engine, I think this might be our last point. No, it's not. Sorry. The empathy engine. Build empathy in your child's ecosystem through stories, videos, and workshops. Now, as a parent, it's important that you advocate by building empathy amongst people. Don't be ashamed or afraid to get involved in teaching in schools. You know, get a child or at church. Or, you know, do book reading at your children's school. You know, so you get a chance for you to teach the children about empathy, other children, not parents, other children about empathy. You know, get involved in any speaking engagement that you can. I mean, that's how you can build empathy. So people can understand your journey, your child's journey, and they can hopefully, you know, be more empathetic towards you. Babe, you want to say something?
Yes. So one of the things that we personally did was we started going to do book readings at my daughter's school, and we would take her favorite books and we would read it to the class. And the schools were very generous in giving us time to come and do that with the kids. Another thing we did was we started playing this video, which I think every parent, you know, whether autistic or nonverbal, whatever your child is, should watch this video. It's called Amazing Things Happen. And it shows you how autistic people view the world. It's a short animated video, but you see how light, sounds, people, everything bothers them. And, you know, I remember we showed that at church and we had so much, you know, comments from people not realizing that, wow, I never knew this is how they experience the world, you know. Dr. Oshiri was gracious in speaking, as well as Dr. Alagbe at a conference we had planned on health and wellness, but we're really focused on mental wellness, but also neurodevelopment with children. And so every opportunity we get, we are trying to build that empathy engine. Is the more we can sensitize people around us, the more we empower our children as well.
Okay, this is calling the pros. So don't be afraid to reach out to therapists and support groups. Don't be afraid to get help, basically. Don't be afraid. But again, it's important that you get the right help, the right resources. Again, this is why we set up Bloomberg, actually, to enable us to give people access to the right people, the right help, the right support. Because again, there's information everywhere, but it's important to get the right information that will help your child.
So just to add on to what Banshee said is, seeing it as a pit crew, on a racetrack, you see the guys that take care of the tires, the engine, the driver. And so just realizing that, the outside of your own, you can't do it all. This group that's the CAND group that's been set up for support, leverage this group, get, the help you can, learn everything you can from those who know a lot more than you do. Just 2 more points. We're done.
All right. And finally, well, 2 more points. It's important that you treat yourself. It's important that you take care of yourself as a parent. It's a lot of work. Taking care of children that are neurodiverse. It is very, very challenging. But as a parent or as a guardian, practice self-care. Treat yourself. Take care of yourself. And then
Finally, just remember that you need to embrace change. Remember that for us, we see parenting like a box of chocolate. If you've ever seen the movie Forrest Gump, it's like life throws at you so many options. And just remember that you need to celebrate every step your child makes, no matter how small, that you remember that progress may be slow, but it is progress, and celebrate that progress. So here is wishing every parent here love, peace, and progress on this journey, and hoping that this has been helpful.
Thank you for listening to us.
Thank you.
Wow, that was amazing. Thank you very much, Mr. and Mrs. Fatoba. Can we give them an round of applause, or, thumbs up, flowers, whatever emoji suits you. Thank you very much, Prof, for the round of applause. Thank you for the hearts. Yes, thank you very much for the round of applause. So we definitely, I'm sure, it's really resonated with everyone on the call. We will allow some questions to come to you, but not quite yet. We would, okay, so this is me trying to find out how best we do it. I think Prof should come on, and then we can have some questions to him. And then if you have questions for the Fatobas based on their journey, how they handle this or that, I think you can put it on the group just so that we can gain time. We're really trying to keep this within an hour. So for those of you that just joined us, you're welcome. We're really happy to have you here. You just listened to Mr. and Mrs. Fatoba, who are parents of 2 children that are neurodiverse, and they have been on this journey about 10 years, about 9 years plus. So without much ado, I'd want to introduce our experts. So please drop the questions on the chat, inquiries for the Fatobas, and then I'm going to introduce Prof. Professor Afolabi Leshi is our in-house expert today. Professor Leshi, good evening, sir. You're welcome.
Good evening.
Yes, sir. Professor Leshi is a professor of pediatric neurology at the College of Medicine, University of Lagos. He also is a professor at the Lagos University Teaching Hospital. He was also the former provost of the College of Medicine. That's the head of the College of Medicine, University of Lagos. He's also been my teacher for years and years, and he's still my teacher. Thank you very much, Prof. He's an autism expert, and he is one of the CAND faculty. Together, we started the CAND several years ago now. And so he's here to really be able to have if we could call it like an open house, where you can ask questions, things that have bugged your mind around the question of autism, and he'll be ready to answer those questions. So I'd like you to please indicate with raising up your hand and let us know if you do have questions. And so between Professor Leshi and if we have anything for the Fatobas, they'll also jump in as we go along. Professor, maybe we can just set the ball rolling by you, maybe giving a few comments, as you've joined us, and maybe following the presentation also. Over to you, sir.
So thank you very much. Let me first of all appreciate the Fatoba family for sharing their journey with us and with me in particular. And I think it just emphasizes one major aspect about the care of children living on the spectrum of autism, that one, it is multidisciplinary, and the family is a very key part of that multidisciplinary approach. And there's no way you can effectively manage children living with autism who are on the spectrum. I think so. That's the first point. So I really must commend them for their dedication and for their clarity. I think what they have so nicely left out is when they had the downs and the lows and the questions and the doubts and how they navigated that, because that is also part of what makes every one of us who we are. How do we deal with the challenges? And there will be challenges. So thank you very much for that. Let me just make a couple of points about autism spectrum disorder. One, it seems as if we are making more diagnoses than we were making 20 years ago. Clearly, there has been a rise in the number of children worldwide with autism, and also awareness of this condition has also increased. So it's a combination of two factors, that indeed we're having more children with autism and where awareness is also rising. The second point, which I'm sure every parent with autism knows and which every doctor has told them, is that there's no cause, no known clear cause of autism. So really the question is, why are we having more children with autism? We can't really answer that question. We know that some associations with some conditions, like a child having a previous history of infections of the brain, like meningitis or encephalitis, or what we call intrauterine infections, that's mother carrying some infections while she was pregnant. We know those associations can be associated with children developing autism, but there isn't any clear cause for autism. Which brings us to the third point about autism, that there isn't a specific cure for autism. And I think that's very important, because people shop around from specialist to specialist, from therapist to therapist, looking for the one that has the magic touch or the cure for this thing. And there isn't. There is management and care. And a number of children will respond positively to the management and care offered by a multidisciplinary team approach. And brings me to the fourth point. There are a lot of therapies, especially when it comes to things like heavy metal chelation therapy, using clearing gut, yeasts, and all that. And there isn't any evidence that these things actually work. What we know would help if there are clear comorbidities, and so when doctors use the terminology comorbidities, things that may be associated with any child living on the spectrum. And these include things like attention deficit hyperactivity disorder, seizures, and things like that, that have specific treatments, which, if properly identified and treated, can help in the overall care and well-being of a child with autism, including behavioral problems. Behavioral problems that are severe enough can be managed. So there are specific interventions for specific comorbidities. And which brings to the last point I want to make about treatment. There's no one treatment fits all for children living on the spectrum. Treatment has to be individualized and tailored to the specific comorbidity that children have. And also, even drugs, different drugs behave differently in different children. So a drug can work for person A and not work, same condition, and not work for person B. And that's part of normal drug-person interaction, normal. So people will behave, different people will behave differently to the same drug. And so the expectation, oh, it worked for my neighbor's child, why didn't it work for me, doesn't arise, all right? Because everybody's an individual. And so with those few points, I know I really want the focus to be on the Fatobas and their journey, while if there are any specific questions related to therapy, I can take them, and I'm not a child psychiatrist. Let's just be clear. So when we're talking about things that are behavioral, I would always defer to the child psychiatrists on the platform, led by the eminent Professor J.D. Adeyemi and Professor Oshodi, and the massive, beautiful team of child psychiatrists that we have. Thank you very much for those comments. I'll be happy to take any specific comments.
Thank you, Prof. So I think we'll just do a mix and match. So right away on the chat, thank you for that foundation. So we have a question that maybe you can take in a bit. It says, please, I have 3 kids, children on the spectrum, but the first has just started having seizures at 22 years. He's highly hyperactive and and it's not very easy for me at this time. Please, how do I overcome the seizure? So I'll come to you, Prof, on that. Then the other one for the Fatobas, your environment, I'm thinking you've been able to go through this challenging time with grace because of your environment. What is your opinion? So someone feels that maybe because you're out of the country, that's why you found it a bit easier or so. So let me go to the chat. We have Ijeoma Uche. Your hand is up. You have the floor, please.
Okay, good evening, everybody. All right, so my child has been, in fact, my child had a seizure.
So is it possible to see a video while we are speaking? I always like to see who I'm talking to, if you don't mind, unless you're not in a state that you can share with the rest of us.
Yes, it helps, actually.
Okay, so sorry. All right. So he had 2 seizures and then started being hyperactive. And we've, been managing him, thinking that according to what they said, he would outgrow it. But he's 6 and it's getting worse. So I started doing a research and I saw something called ADHD, so I'm like, okay, could this be the problem? And then on my quest for research, I found out that I'm actually, I have ADHD, like per se, because I've been going through some stuff which I don't understand or I didn't understand up till now, so I am about visiting a neurologist, but I'm scared of the drugs because of what they're saying about the drugs. So I feel they are going to recommend drugs for me. So my question is these drugs okay? I don't know.
Okay.
Okay, Prof, you have 2 questions. So Ijeoma's
yes,
question and the first one. Yes.
And I'll take, without addressing specific children, because really before a doctor decides on prescribing, we would normally go through history taking, carry out examination, and make some evaluation, all right? Because there are things that decide what direction you go. But let me speak generally. So if it is clear that a child, and again, taking the comment from Mrs. Somebody who said she has a 22-year-old child who has, it's actually labeled TechnoSpark, but we'll assume TechnoSpark is the device, who has a 22-year-old child who's also hyperactive. So these are, as I said, comorbidities. And it's important that the comorbidities are properly diagnosed and treated, because from the point of view of the seizure, once a child has had 2 or more seizures, that child requires treatment. So it's one single episode of seizure will probably investigate. 2 seizures, then clearly we would need to consider treatment for that individual, whether child or adult. And of course, the type, like I said, we have to interrogate the type of seizure and all that, because all that goes into determining what medications we're going to use for the child or the adult, since we have a 22-year-old on the child we're talking about. And treatment does help. Similarly for ADHD, attention deficit hyperactivity disorder, it also requires investigation, diagnosis, and there are a number of diagnostic checklists or criteria to diagnose things like that, ADHD. And generally, from the point of view, from my practice, and I'm speaking as a pediatric neurologist, if a child who has attention deficit disorder is severe enough to cause disruption in class, so you get the report that, oh, she's disruptive or he's disruptive, and 2, learning is affected, then clearly there's need for intervention. And there are levels of which we deal with, how we deal with ADHD. We go from behavior therapy to medication and all that. So again, it's individualized, and I cannot, except to say that if we're clear that the child has seizures and the child does indeed have ADHD, a diagnosis needs to be made and treatment needs to be started, because we know that when these comorbidities coexist, it can actually impede the response to therapy of the primary problem of autism spectrum disorder. And then drugs. There's always a concern about drugs. And that's why doctors would always want to be sure that I have every justification to put a child on medication. There's no medication that does not have side effects. And I've told you in my comments that people behave differently to medication. So I could use a medication on a child and there's no problem. I could use the same medication on another child and there's a bit of a reaction. So we would have to, but at every point in time, you must be talking to your doctor who prescribed the medication. Give him feedback. It's not as if there's only one drug that we can use and there's no other option. So when you discuss the reactions, they can then tailor the drug, reduce, change, or give a drug that counters the side effect of some of the drugs. So what you do really depends. And there, like I said, there's no one-size-fits-all treatment. It's individualized. I hope that has addressed the question. So doctors will prescribe drugs knowing that you could react, but we will often start with the lowest possible dose and work our way up. That's the general teaching of how we use medication. And of course, we will be counseling you at every step of the way. So a good doctor will not hide the medication they're using for your child and will tell you, this is the drug, this is why I'm using it, these are the possible side effects, this is what you can do, let me know, and this is what I will do to try and ameliorate some of the side effects. So I hope that has answered the 2 comments and questions.
Yes, thank you, Prof. I can see TechnoSpark, your hand is up. I'm coming to you. Ijeoma, I hope you're satisfied. You can lower your hand.
Yes, yes.
Before we, thank you very much. We do have some comments in the chat, which I'll just take. But before I do that, I just want to remind the parents in the room that one child with autism is what it is, but what that is, just one child with autism. One child with autism is not every child with autism. And like Prof said, these comorbidities, things that can coexist with autism, are varied. Some children we have certain things called specifiers. These are the things that coexist. Catatonia, other neurodevelopmental disorders, seizures, presence of language or not having language, genetical disorders, and the autism can combine them in different ways. And it's important that we take care of these things so that it doesn't hinder their learning or development in other ways. And please, Ijeoma, don't diagnose yourself or your child. Kindly let them be seen, you know, so that we're really sure of what exactly is going on. So I'm going to read from the chat. I'll come back to you, TechnoSpark. Sorry, we're calling you that because that's all we can see on the chat.
You can rename yourself, though.
Yes, please rename yourself. So from the chat, so there are a few things. There's a feedback survey. Please take our time and click on it, everyone, and just give us a bit of feedback because so they can guide us. So Ayobami Ogundipe Otalo says, my son suddenly developed discomfort in his tongue, stuck down his mouth, and we have a challenge with his pronunciation of I, as in laugh.
I think it's L.
Okay, as in laugh, fly, etc. He sleeps late now, despite the lights out, and tends to laugh a lot more. It looks like you're trying to find out what's going on, isn't it? Prof, I don't know if you have something to say to this, but let me read the other one. Thank you. Good evening. Thank you for an educative meeting such as this. My name is Damilola, and I'm an oncology nurse. I once had to nurse an autistic child, but it was indeed an uneasy experience for me. I'd like to say if there are platforms available for certification courses to better equip one in managing clients on the autism spectrum effectively. So those may be some of the things that we can maybe probably provide some guidance with. You know, if you reach out to us, we'll share our email and contact because we definitely don't have all the answers, but maybe networks, you know, with other people that run some of these things, we'll be happy to share. So Prof, there was that one comment or question on the chat concerning, yes.
So the question I would have to ask, is he on any kind of medication? Because we know some medications can be associated with the side effect of what we call dystonia or tongue twisting or something like that. So I really would need to know what's the background to that, because it looks as if it's a new onset symptom. And so the question is the person
he's
on
not on medication, sir.
He's not?
Yes, he's not on medication.
Right, okay. So, you know, sometimes it's very difficult to answer specific problems without the background of taking a history and doing some examination. So I would honestly say that maybe you should see someone, pediatric neurologist, who can do some interrogation further. But honestly, I can't answer without, and that's the challenge of meetings like this, that we can only be speaking generally and not provide any specific, unless it's so obvious, all right, as to what you're asking. So if something's developed suddenly, I would want to know what has happened, if there's any fever, any change in circumstances that can explain why he's now having a challenge pronouncing L, which I assume he was doing before, or he never did it before. I don't know. So sleeping late at night and all that could also be a function of what is he eating and what are his activities before he goes to bed. All right. So again, is he taking things that may keep him awake? And sometimes we assume that some drinks, like soft drinks, are innocent. There's nothing innocent about caffeine-containing drinks or energy-containing drinks or those energy drinks, including things as simple as, without having to mention any specific brand, what comes to my head is this Lucozade Boost, and as an example. All right. So we need to interrogate those things that happen before bedtime. And laughing a bit more, would have to interrogate that to find out if there are any other associated behaviors, because we know that some seizures can present oddly. Not every seizure presents like a convulsion. All right. So again, it will require a detailed evaluation, much more than we can provide on a forum like this. I would just advise either you see us or come and see us, and then we can set up an appointment in the context of LUTH or in the context of a private facility. But I can't say more than that.
Thank you very much. So someone's asking
how... I mean, if you are, please, I mean, you are also an expert in these matters, so let me know.
Yeah, so what we can do is, if anyone does think that they do need clinical evaluation, we do have appropriate services in the Lagos University Teaching Hospital, that's LUTH, not lawsuits, because I know someone was saying, how can they see prof in lawsuits? We always mix up lawsuits and LUS. We are from LUS, the Lagos University, the one in Idiaraba, the very big one. Okay, so one thing that we can do from CAND is we can assist with referral notes if you do need to see prof in the clinic. And, it can, once it's from CAND, prof will definitely, at least be able to schedule something. So if you want that assistance, please don't hesitate. You can drop a message in the chat. We have someone who will grab all that detail, like just saying, I'd like to get a referral, and you get some details of how to reach out to us. Mrs. Idongesits, Umana, I think you are techno 1 minute ago. Were you techno? I see your hand up.
Yes.
Okay, so we have your real name now. All right,
Yes.
so please, you have the floor to ask your question or to add an additional comment. And then we can take other questions before we round up.
Okay, like I said, the seizure started at the age of 22. And we've tried a lot. We went to lawsuit. The lawsuit, yeah, that time Lut was on strike or break, something happened that time. So we went to lawsuit. We've done a lot of scan and tests. We've done brain tests, we've done MRI, EEG or ECG, and we've done blood tests. And then it was prescribed this drug, what was it? Tetrakol.
Tegretol.
Tetrakol, Neurostan, and Respiridine.
Okay.
And he has been on this, yet we did not see any improvements. And so when I even checked the side effects of that drug, that Tetrakol and Tetratol, what do they call it, and Respiridine, I really was disappointed, and I stopped giving him just on my own.
Okay, if I may just say some, Mrs. Dongesits, thank you. I mean, you have just shared an experience that many parents, seem to go through, and you have responded the way quite a few parents may also tend to want to respond. But I'll just want to encourage you to not give up on getting him properly assessed and placed on the required treatment. Like Prof said, if you listen to him when he started, he said, every medication has side effects, and no doctor wants to place a child or anybody on medication that they don't need. When I say no doctor, generally most doctors, well, maybe there may be some careless, indiscriminate people, but most doctors that want to really do their work are going to make choices based on diagnoses that have been made. A child that's having seizures and the seizures are not being controlled will have more seizures, and it will get worse. And unfortunately, learning will then be affected because it leaves damages in the brain. So if this conversation does anything for you, it's just, and I know Prof has really taken time to answer your question, is to encourage you to please engage back with treatment. In the chat, Mrs. Ayo, I think you put a comment, Ayobami, that you've been to LUS before and never saw a doctor. Please come through us in CAND. We'll guide and facilitate who and where you should go, and you will see a doctor. We're not marketing LUS, but it's just where we work, and experts are there, and there are people that do benefit. There's not a magic pill, but a lot around the condition can be managed. Before I come to Rafati, I want to say that the presentation by Mr. and Mrs. Fatoba should do one thing for us. Because when you're dealing with a condition like autism, that it's not like malaria, that you're going to take a medication and everything disappears. You're sitting with so much, and it seems like, when is this ever going to get over with? But they've given us tips of what is in your control. There are many things not in your control. There are many things that you're still maybe struggling with, but let's keep an eye on what we can do while we keep on, reaching, for whatever support you can get along the journey. So I'm going to take 2 or 3 more, and then we will round up.
Hello, madam.
Okay,
Hello,
I'm coming to you, sir. Who is speaking?
Yeah,
Rafati?
Mr. Umana is talking.
Okay, Umana, yes.
Thank you. I've just come in and I had the conversation I've had from doctor. And
Yes.
I want to say that I really, from Prof, I want to say I really love it. But the point is that we have a parents association. And in the parents association, we have some people that have experienced it up to 40 years, some 30 something years. And the advice is that, see, these children, you don't need to give them, there's no drug that is good for them, even paracetamol, that what they need is supplements. And in fact, with things like that, looking at the side effects, I remember I called a doctor overseas, who is a relative, and said, are you sure that I'm not killing this boy installmentally? If these are the side effects, because the very first one we started with, though it was not recommended by a neurologist, by a chemist, was something else that we thought ignited the seizures, Olanza 5. So when I look at the side effects of Olanza 5, and again, I checked the side effect of this Tegretol, I was forced to ask the doctor, I said, are you sure I'm not killing this boy installmentally? So that is the problem. When we meet as a parents, they said, what do you need to give to these children is only just supplement. No drug,
it's okay. Thank you, sir. Mr. Umana, thank you very much. And I think Prof will respond to it. I want to take the question by Rafati and the Fatobas, and then come back to Prof. Parents are parents, they're not doctors, and they observe the children, they live with the children, you know these children. Work alongside your doctor to make sure the right medication is given, if there should be medication at all in the first place. Your job is to parent and love and advocate and work with the clinicians or the experts in whatever area to get the best for your child. Mrs. Rafati, please, ma. You have the floor, ma.
All right, thank you very much for having me.
Thank you.
My name is, I don't know, I think I spelled my name wrongly. My name is not Rafati, it's Rafatu. Okay, so I have an 18-year-old. He's going to be 19 next month. And I'm concerned, I was concerned about the parents who said they are taking their children off medication because they went online to read about side effects. If you keep going online to read about side effects of whatever you are giving your child, you may be doing your child more harm than good. What I think has worked for us in the 18 years of managing my son is that when you are giving your child a medication, you are supposed to sit with that child and monitor the child for any changes at all, whether positive or negative. When you see that some things are happening to your child that were not there prior to introducing those medication, then you call your doctor.
Exactly.
So you may actually be doing more harm to your child by removing your child from the medication. So please discuss with your doctor. Stop going to Google to check your symptoms or to check side effects of medication. You may harm yourself the more. That's my first comment. And secondly, about seizures. If you also take your child off medications for seizures, the seizures tend to get worse. I have experience in that too, because my son was having seizures and then I took him off abruptly and the seizures came back and they were worse until we had to get, another medication that has stabilized him. And I've been told that if I'm ever going to take him off those medication, it has to be gradual withdrawal. That is, if the doctors feel he should be off the medication, they will gradually withdraw those medications. So I just want us to be very careful with how we introduce medications and take out medications. Thank you.
Thank you very much. I think let me just, before Dr. Shudi makes a comment, I really want to appreciate what Alaja Rafa too has just said. you have made honestly, this is the reason why there should be a parent-to-parent forum. You see, the experience of another parent in explaining the challenges they went through will help another parent. And she said two very important things. Sudden cessation of medication can be deleterious, and doctors will never stop a drug suddenly unless the child is having a severe adverse reaction. And when we do that, we will replace immediately with something else. Secondly, going to Professor Google or Dr. Google. Honestly, I encourage people to look for information, but what you find, cross-check with your doctor. Google and internet is here to stay, and we will always find information on there. In fact, there's useful information out there, but you must filter it, and filter it with your physician. That is the only way you can get the best, because that person who has filtered it for you will help guide you better. And thank you very much. I just wanted to make those comments before Dr. Shodi says anything.
Thank you, Prof. I think you took the words right out of my mouth, and thank you very much, Alaja Rafatu, for your shared experience. I'm sure that people have, they're encouraged and they've already received a bit of guidance just hearing from you, and that's what we need to be able to have the benefits of that. Thank you, sir. Fatobaz, please, you have the floor, and we'll take one more. It's 7 already. We need to stop, but we're just going to take one more comment and then we will go. So, Mrs. Fatoba.
Okay. Yeah, we just wanted to respond to the comment. Someone had mentioned that perhaps the environment we're staying in is the reason why we've been able to make progress. I just wanted to state that we're on vacation. So we live in Nigeria, and a lot of the progress we've made with our kids have come from tools, resources, specialists, and support we've gotten from Nigeria. And again, like Dr. Oshide has said, there's a lot of resources. This group is one of those resources. Feel free to contact Dr. Oshide if you have questions, and keep attending these groups. We can all share what's worked for us and what hasn't worked. A lot of things we've tried haven't worked. Some have worked, and we just keep building on that. And then Dr. Oshide, somebody had mistakenly sent a comment to us, I think was meant for the group, and they were asking if there was a link between antibiotics and violent tantrums, because they recently finished a bacteria infection treatment on their son, and he's been throwing aggressive tantrums since the treatment.
Okay, thank you very much. Prof will come to that. And let me just read this last question, and Prof, you talk about the antibiotics and treatment. It says, my 4-year-old daughter and my 6-year-old son gets really active around bedtime. I try to calm them down, but they enjoy jumping on the bed to get that stimming effect. How do I support them? Also, when my husband is relating with them, they are more anxious about his reaction if they don't do as told. With this in mind, they cooperate. On the other hand, when I'm relating with them, they are less cooperative with bedtime and general tasks. Instead, they want to play. This makes my husband sometimes say that I'm not firm with them, forgetting that our special children masks. I'm not sure what you meant by mask. Please, I need you to throw more light on this. So, Prof, you have 2 questions. The one that the Fatobas spoke about, and this one, and then we'll
Yes.
call it a night.
All right, so thank you very much. Just straight away, I honestly, what you're telling me about antibiotics and aggression is really new to me. I'm not aware of any antibiotic that would directly cause behavioral changes as a side effect. And again, maybe Dr. Shodi, Professor Adeyemi, and I see Dr. Alagbe is on the calls, if they've had any experience of an antibiotic causing behavioral or psychotic side effects, I'm not aware. So I really cannot comment on that, except to say that I hope it's not a coincidence that some people relate, because the illness itself, some children can react to the illness all right? And you could also have what they call conversion reaction, maybe to the attention, and the attention when they're getting better stops. And therefore, there are all kinds of things that can be related not to the antibiotic, but to the actual illness itself and the behavior around and the dynamics around the illness. And the psychiatrists are in a better position to explain that. The other issue is about the 6-year-old and 4-year-old who are jumping around, can't calm them down. There seems to be some discordance between the father's disciplinary action and the mother's disciplinary action. This to me sounds like something that behavior therapy can deal with, and something that, again, the behavior experts might be better suited. Except, generally speaking, when we so if children have sleep disorder or poor sleep hygiene, one of the things we recommend is that you reduce activity hours before they go to bed. So before they go to bed is not the time to watch an active cartoon that they like. It's not the time to engage in games that can excite them. Because a lot of these things are hormonal and transmitter driven. So once you're excited, some of the transmitters take time to go down and settle and all that. And sometimes some people get the notion that, oh, maybe they will have a chocolate drink before they go to bed. One of the things that, especially the darker the chocolate, is high in serotonin. And serotonin it's a compound in chocolate. And so again, there's some things that we need to look at what you do around bedtime. As to why they would respond to your husband and not respond to you, Nigerians have a common terminology. Maybe they have seen you finish, and therefore you're not consistent. You need to be consistent in discipline and reward between couples and everybody around the child. So and children are very smart. They can actually read that, oh, this one is not as disciplined, and so I would defer to the behavior therapists on the call in dealing with the issues around trying to get a child to be calm before bedtime. If it's not a medical thing, like you're taking something like some extra stimulant or doing something exciting around bedtime. Dr. Shodi, I defer that one to you.
Thank you, sir. Thank you very much, Prof, for the answers. And
sorry, the part of us have also dropped something. And I totally agree with that.
Concerning the probiotics, or which one?
No, calming music to our kids.
Okay.
They play calming music to our kids before bedtime to wind them down. I totally agree with that.
Yes, and I think music. Just having, there's something we call sleep hygiene in mental health, that you generally kind of like have a procedure towards winding down, almost like you're shutting down a computer, where you say, okay, you take a bath, turn the lights out, have your cup of coffee, or not coffee, definitely not coffee, have your cup of beverage, lie in bed with them, milk, lie in bed with them, read them a storybook, calm them down. And eventually some of them would, in some very rare situations, you may find out that they're so agitated and worked up for whatever reason, and that may need to then be investigated further. They may need some help with meds. But generally, if you have a routine, a bedtime routine, that may help. Some children have ADHD, and today is not the day for ADHD, maybe another day, and that may make them struggle a bit with bedtime. We have come to the end. I'm just going to say a few comments, and we round up so that I don't also exceed our time too much. So when we call you next time, you will come. Prof, thank you very much, sir, for the questions you've taken. And for anyone that still has any question, you can send us an email, and then we can always get it to Prof and get it back to you. You can find us at in the College of Medicine, the RBRR building, that is by the College of Medicine gates, the first floor there. CAND has an office there, or email us or contact the group admin if you're on our chat. Someone said that aside from seizures, what other characters or symptoms would warrant giving the child medication? So as a baseline, a lot of children with autism spectrum disorder do not require medication. they may require behavioral therapy and behavior analysis and all that. But there are a group that will require medication. At times they have coexisting conditions that have to be treated. And there are several things that may require, for example, a child that has comorbid ADHD, attention deficit hyperactivity disorder. Learning will be affected. So we need to treat we may need to treat the ADHD, seizures, you know, other behavioral difficulties. Some children on the spectrum can actually become, you know, depressed as they get older. They may need to be treated. So it's not everyone, but some would. On that note, I think without repeating ourselves too much, we've come to the end. I want to acknowledge the presence of Professor J.D. Adeyemi, who is the director of CAND. Good evening, Prof. You're welcome, sir. Thank you for joining us. Yes, sir, he's been here right from the beginning. Thank you very much, sir. Then Dr. Tunde Alagbe, thank you very much for taking our time to join us. Would like to, we appreciate your presence and we're happy to partner with you and collaborate going forward. So please,
we need feedback, ma'am.
Yes,
feedback
yes, we have a feedback link on the group. You can drop, please find the link, kindly help us complete it, give us some suggestions, give us other topics you'd want us to focus on when we have our next interactive meeting. And if you do want us to reach out to you, drop it in the comments of that chat also, and we will come back to you. Thank you very much, everyone. It's been a pleasure having you. Thank you, Professor Leshi. Thank you, Mr. and Mrs. Fatoba. And thank you all for coming out this evening. I wish you all a wonderful weekend. See you in another 3 months when we come back with our interactive meeting. Thank you very much. Have a good weekend.
Bye-bye.
Good night. Bye-bye. Bye-bye. We'll leave the link on for a bit in case you still want to complete it. Thank you.